Thank you for joining us. Today I have Dr. Richard Price. And Dr. Price, tell me a little bit about your background.
So I originally trained in the UK. Went to a place called Guy's Hospital, and I graduated from there in 1979. I then worked up in Scotland, Edinburgh, for a while, and in 1982 I went to Michigan, where I went to grad school for 2 years at the U of M.
Go Blue.
Go Blue, that's right. That's why I'm pleased to be back here. And then after that, I moved up to Canada. I just intended to stay there for a year or two. Definitely didn't plan on staying there forever. And my parents didn't like the fact and then decided to go and stay. And then I got interested in research. I wouldn't say it was because I was a bad prosthodontist. It was because I got interested in research. And I went to some meetings, and I found like the future is going to be resins, I thought. And so I got into bonding, adhesives, and just kind of exploded from there. And then I went to Sweden. I did my doctorate there, and I graduated in 2001, September 2001 from Sweden with my doctorate. And I stayed on at Dalhousie. I've been teaching there. So in all, I've trained in the UK, I trained in the States, I trained in Canada, and trained in Sweden.
Wow, okay. And so you made your focus curing lights. Is this, what about curing lights?
No, I've made my focus on resin polymerization.
Oh, okay,
so,
yes.
What happened was I got interested in resin polymerization, and I couldn't understand why I was getting weird results. And so somebody said, well, have you looked at the light?
Mm-hmm.
But no, I do a lot of research on resin polymerization. So, bulk filler resins, conventional resins, floral resins, adhesives. Again, if you go and look at my CV on Google Scholar, you'll see there's a whole range of stuff on there. A lot of it's on resins.
All right, so today we're going to talk to Dr. Price a little bit about curing lights. And we're going to go kind of from the assistant perspective. So most of you who've done anything with Dental Advisor before know that I, Dr. Anna, the clinical editor here at Dental Advisor, actually started out as a dental assistant for 10 years before I went back to dental school. And so I have quite a perspective when it comes to the dental assisting side of the chair as well. When I think about the dental assisting side of the chair when it comes to curing lights, Dr. Price, I think that the dentist places the material, and then now all I have to do is shine the light. Mm-hmm. And as long as I'm shining the light somewhere on the tooth lights up blue, I'm in good shape.
Yeah.
Am I right? Am I wrong?
You're absolutely right. That's what happens, but you're totally wrong as to are you going to get a good result from that? You will cure the top of the tooth. There's no question about that. But will you cure the bottom? And just today I did a very simple experiment with scientists here at Dental Advisor, showing that you need to hold the light over the tooth, and you have to cure it properly, because if you don't do that, and the light is just somewhere in the mouth and the thing kind of goes blue, that just ain't going to work. And I've given you guys some ideas as to how to demonstrate that to everybody.
Great.
Yeah.
So I have to cure it right. So what exactly would be the right way to?
So the light has to be close to the surface of the resin. And then also light doesn't travel around corners very well. So that's the reason why you want to have the light perpendicular to the surface of the resin restoration. Mm-hmm. If you have it at an angle like this, then the light just kind of bounces off and you get a really poor cure. And then in addition to that, you get shadows down here because it's at an angle. Mm-hmm. So you want to make sure the light's right, going straight down on top. Which is why, hopefully your doctor's going to give you a curing light that allows you to do that. Because if the light, you can't get it in, and you're struggling to get it in, and the light's going to be at an angle like that, it's not a good curing light.
And you bring up a great point. There's so many different curing lights that have so many different angles on them, and so many different tips on them. Yep. And, some are a little bit more pointed, and some of them are more flat. Is there one that's better than the other, or as long as it...
Okay, so I like the low-profile heads, and so... You may say, well, does that mean that he only likes the Velo or the Smart Light Pro? No, actually, the Blue Phase light from Ivoclar has got a low-profile light guide on it. In other words, the tip is low profile. It allows you to get into the back. But some of them, the tip is sort of being like this. It's kind of like that. And then that means you really have to change the angle. So the best thing that I can suggest is that, if you want to see if I'm talking a bunch of garbage, is to ask your doctor for a deniform, or maybe you've got a deniform in the office. And if you don't have that, then get an articulator with some models on it, and then just try and get that light in to the very back tooth, and see if you can do that. And then see how wide you have to open up at the incisors for that. So if you have to open up more than 40 millimeters at the incisors, that's, 40 millimeters is about the average for most people. But some people with trismus or, small mouths, they're down to 30, maybe even less than that, 20. So you need to look at that. And so just by taking a deniform and looking at it, then you have a pretty good idea of, is your light any good? And unfortunately, this brings us back to people just not knowing or understanding about the light and how important it is. Because you test it on the lab bench and it looks just fine. But if you then go and put it in a clinical situation, then you quickly realize that, we've got a problem here.
And you bring up a good point too, because it can be so hard, you have the matrix band sticking up and the tooth is in the posterior, like having one that has the tip that has the right angle and angling it properly. And absolutely.
So there is another part to that. You asked about light curing. So I said it has to be, perpendicular or right angles to the surface. You also want to get the light fairly close to the surface. You don't want to have it too far away. But of course, your doctor's going to get very angry with you if you go and touch that beautiful composite that he spent the last 5 minutes sculpting and everything. Well, the answer to that is that you start the light curing from a few millimeters away. And you will find, you can do this on a deniform, the top surface is going to be almost instantaneously hard. Within 1 second, the top's going to be hard. So after 1 second, you can then bring the light in really close. So you can actually touch the tooth or touch the mylar strip after, you've got to be safe 2 seconds, but my advice is to try it in your office. And you may say, well, Richard, why do you have to say 1 second, 2 seconds? Can't you be more precise? No, I can't. Because as you saw, the power from the lights is going to vary from, 400 to 2000. So the 2000 milliwatt of power light is going to cure a lot faster than the 300 or 400 one. So there's a bit of a range there, but they will cure really quickly. And they're going to cure quickly because if you use headlamps or you use a headlamp or the doctor uses a headlamp, unless you put the orange shield down, if you're working away on that composite for a minute, it's set. It doesn't require very much light to cure that top. But the bottom is certainly not set.
And so that's really important too. My doctor's using more bulk filled materials. If you're saying that, then that's a really good tip, because making sure that you're getting that light tip closer to the material to get deep down to those deeper the end of those deeper restorations, because you've seen in your research with polymerization where it's not curing all the way to the bottom.
It doesn't cure to the bottom. And so, when the manufacturer talks about, a 4 millimeter or even some cases, even a 6 millimeter depth of cure in some composites, that's a long way down. And sometimes the resin is not cured to the bottom. And if it's not cured at the bottom, then there's no bond. If there's no bond at the bottom, there's a problem.
And Dr. Price just did a lecture for us at Dental Advisor here where he spoke about some of those curing lights that you can find on Amazon, on eBay, that say that they have maybe like a 5-second cure. That doesn't necessarily mean that they have a 5-second cure. So just very briefly, because hopefully you guys will go to our lecture and you'll be able to watch that. But as an assistant, just why wouldn't I want to find my doctor the best deal and get him a 5-second curing light on Amazon, as opposed to what the rep is going to sell me for a lot more?
Well, first of all, what the rep is going to sell you is I assume you're talking about like a rep from Henry Schein or Patterson. So those companies are what I would call reputable companies. and they are not going to sell you an unlicensed device. They have large divisions in their companies to make sure that what they're selling is licensed, because if it isn't, they're going to get sued and they're going to have major problems. If you buy something on Amazon or eBay, then there is zero protection. In other words, it is very much a case of buyer beware, and the products are sold as is. eBay, Amazon take no responsibility for what's being sold. So it's up to you then. It might be a good bargain, but you need to do your homework. There have been cases of fake drills, not fake curing lights. Although it's interesting, if you go onto Amazon and have a look, some of you may have heard of woodpecker. So there's a woodpecker curing light, which actually does have a 510K. But there are woodpecker style curing lights that are literally unbranded curing lights. They look exactly the same as a woodpecker, but they do not have the woodpecker logo.
Oh, okay.
And I'd be very happy to share that with you if you like, but I'd show you that information. But you can get fooled by these words, woodpecker style or woodpecker light, curing light.
Mm-hmm.
What I'm getting at here is that when you buy stuff online, you need to make sure that it is FDA approved for use on patients. And sometimes, you might see a really good deal on a bonding agent or a good deal on a composite. And especially with COVID right now, you don't know if that product has been sitting in a heated or unrefrigerated warehouse for a year or 2 years. And sure, it might not be at its expiry date, it may be close to it. And you may think, oh, it's got a few months left in it, I'll buy that, it's half the price. But it's probably been cooked and it may not work as well. So you have to watch out for that. So my advice is always to buy from Henry Schein, Benko, Patterson. Yes, it may cost more, but at least you have some guarantee that you're buying the real thing, mm-hmm. not some fake thing.
Mm-hmm. And you bring up a great point that these are medical devices. And so, in dental realm, we don't always necessarily think about it that way, especially on the dental assisting side. We don't learn anything about FDA or 510K or anything like that. But these are medical devices that are regulated by the FDA for patient safety and also for your safety. And so speaking of your safety, do I really need to wear those orange glasses?
Yes, you do. You really do need to wear the orange glasses, or at least have some orange protection. Mm-hmm. So you can use a shield if you don't want to wear the glasses. But we discussed that a bit in the lecture very briefly. There's something called a blue light hazard. And I think we're all aware of the fact that the curing light delivers a lot of blue light. And it's way more than you will get from the TV screen or from a computer monitor, things like that. So I would really recommend wearing orange glasses. They can completely eliminate the hazard.
Oh, wow.
Okay, so it's down to like sort of 0.5% of light coming through, and that's the reason why they are orange. And in fact, by the way, you mentioned orange, but really the redder the better. If they're red, the reason why they're so red is because they block out more of the blue light. Mm-hmm. So the redder the better. But the ones that come with the companies or Uvex, mm-hmm. the company that sells the light, they're great. Mm-hmm. And so I do recommend those. I find the shields that come with the curing mm-hmm. lights, they work as well, but I find they get in the way all the time.
Yeah.
So I take those off and I use either orange glasses or I use the paddle. Mm-hmm. There is a very good, can I mention a brand name?
Sure.
So there is from Kerr, called Vision Savers. And the Kerr Vision Savers, these are flexible, single-use shields mm-hmm. that I find excellent because I can kind of form them around the oral cavity, the opening, and they can, they're actually designed to be used that way. You just kind of fold them around, and they can. And although they're very thin, you may say, "Oh, well, they're not going to work as well." They actually work really well, and they block out the light. So if you haven't seen them, they're from Kerr.
All right.
Kerr Total Care.
I feel a clinical evaluation coming on. All right. So we mentioned a lot about curing the right way. So if I'm kind of worried that I didn't cure well, can I over-cure my materials?
That's a really good question. The answer is no, you can't overcure the material. Just think about the CAD/CAM blocks that you get, the resin blocks. They are essentially overcured. they're not overcured. They're just really well cured. And if you could overcure something so that the properties were diminished, you would see it in the blocks. You don't see that. The danger of overcuring is that you will literally either cook the tooth, the pulp, or the gums. So you have to watch out, and actually should we say, the downside of using a light with a big tip. Because a light with a big tip, if you're not careful, especially with doing a class 5, maybe half of the light is going over the gums. So, in those cases, a smaller tip is really better when dealing with class 5s. However, of course, when dealing with like a veneer or indirect restoration, you want to have a big tip on there. So, in a way, again, more coverage. Yeah, more coverage, yeah. So, people, again, they sort of ask me, and not kind of singling out a particular company here, but Ultradent, like their first Velo had a small tip. I still actually recommend that because if you're doing a lot of pediatric patients, if you're doing a lot of class 5 restorations, I would use that. But if I'm doing indirect restorations, then I would use the larger Velo Grand. And the other thing that I would like to suggest here is that the Velo Grand and the Velo have got 3 different settings. They have a standard, a high, and they have the extra power setting. Now, the extra power setting is only on for 3 seconds. And some people would maybe say, I can use that to cure my resins much faster. I would caution against that. It's not a good idea. However, the 3-second cure is great for indirect restorations because you need to have a high power light to penetrate through the composite or the ceramic. So the way I describe the Velo is the standard is for my direct restorations and for my bonding agent and such like. And the extra power setting is for my indirect restorations. And the high is in between if you want to use that, but I only ever use the standard or the extra power. Make sense?
Yeah, great.
So you need to have a high irradiance to get through your indirect restorations. Your regular stuff, you can just use a standard.
All right, so if I want to know if my curing light is curing the way it's supposed to, what should I do?
Well, you should go and buy a dental radiometer, or else you should subscribe to the Blue Lights Analytics checkup service where they will test the light for you. So there are 2 options there. The best radiometer that I can recommend that we've tested extensively is called the Blue Phase Meter 2. That's made by Ivoclar, and it's a nice portable radiometer that will measure both the power and the irradiance from a dental curing light. Now I say power and irradiance because it basically measures power, but if you put in the tip diameter, it will give you the irradiance. It'll also give you some recommended light exposure times for the composites you're using. So it kind of does 2 things at the same time.
And you brought up a very good point just now. So it can actually vary the composite shade as far as the time that you want to cure that.
Absolutely correct. So the darker shades usually require a longer amount of time than the lighter shades. Of course, it depends upon the manufacturer's instructions for use, but when people ask me, what would you do if you give some recommendations to somebody with regards to light curing, the first thing I say is read the instructions for use and make sure you follow the instructions for use. It's just like baking a cake, unless you're really, really good at it, make sure you read the instructions. That's the first piece of advice. And then make sure the light's working properly. If you go to a dental lab, for example, then you'll find that they will often calibrate their furnaces. They'll always often go and check how hot their furnaces are, because if the furnaces are the wrong temperature, then the crowns for that week might not be very good. So that they often will check their furnaces, and that's what you have to do as well. You have to check the light on a regular basis.
So As a dental assistant, it's still very important if you have that light in your hand to make sure that you are getting everything cured properly, because if it's not cured all the way through, then ultimately you're going to be seeing patients coming back with sensitivity, you're going to see failed restorations, which ultimately is going to take up more chair time and going to be less productive to the practice. Are there any other tips that you have on how dental assistants can help make with the curing?
Don't drop the curing light. Even the curing light, such as the Velo, which they claim is pretty much indestructible, I still would be very cautious about deliberately dropping on the floor. But no, don't drop the light. But if the doctor's going to buy a light, that's one of the reasons why I like the Velo and the Smart Light Pro as well, because they're metal, they're really pretty durable lights. Lights that have light guides on the end, they are prone to damage. So, if you have a curing light that is damaged on the end or has got a ton of composite resin stuck on the end, then you want to make sure it's nice and clean. So, at the end of the appointment, you check the curing light, make sure it's working okay, make sure it's not been damaged. And certainly every day, part of the process that I would go through is that I would go and check the light, put it on the meter, make sure it's working fine. That's my advice.
And we laugh, but they roll. We all know that they roll, and you just pick it up and it turns on, life is good.
Yeah.
But checking it to make sure, because you've had an experience before where you've seen that happen, and the light lit up, and so it seemed like life was good, but it actually had a much lower output, and they were seeing issues in their composites and other materials that they were curing. Mm-hmm.
The other thing you can do is that some manufacturers do provide little sort of test devices or test jigs where you would fill them full of composite and light cure them. And it's important to light cure them as you would do it in a patient. And so with that, what I'd recommend you doing is putting the curing light over the test jig, turning it on and closing your eyes and looking away. And the reason for closing your eyes and looking away is because it kind of simulates what's going to happen in the mouth. Mm-hmm. The patient's going to move, you might wander off the target and not realize that. So, you should do that and see what happens. Maybe you'll find that, I can keep the light in the same place all the time and everything's good. Or you may find that when you turn away, kind of simulating talking to the doctor, that it does actually wander off the tooth. And there's nothing more soul destroying than looking at that composite afterwards and seeing the bottom is just mush.
And we're seeing more and more curing lights that are coming out with these guides now too. Mm-hmm. They feel the movement of your hand, and they give you a little buzz, because it is important to keep it on there. And now switching hats really quick and putting the doctor hat back on, there have been quite a few times where I've grabbed that tip and nope, the tooth is over here.
Yes.
All right, keep telling me about your weekend, but absolutely.
That happens all the time. Personally, in practice, I like to do the light curing myself because I know it's kind of important, so I hold it over the surface. Mm-hmm. And when I'm doing the light curing, that's actually what I do. I start just a millimeter or so above the surface and then bring the light in close after it's hard on the top. And then I've got my fingers actually holding on the tooth. Mm-hmm. And that does another thing. Can you think of what that does? Having your fingers over there. Don't mean to put you on the spot, but can you think of what that does?
Oh gosh, so
I'm holding it on there with my fingers.
Yeah, so am I creating shadows?
No, you're not creating shadows. No, it's actually telling you when it's cooking.
Oh yeah.
And seriously, that's a really important point, because sometimes you'll find that especially with these really powerful curing lights that are delivering like 2 watts of power, you're holding it over the top, and that's getting warm. That's getting really hot. Mm-hmm. When it gets really hot, then it's time to turn the light off. Mm-hmm. And that does happen. So I use that as a little sort of internal check for myself to know when it's getting too hot. Mm-hmm. I see that all the time with powerful lights now. Mm-hmm. So my advice is start a millimeter or 2 away. After 1 or 2 seconds, bring the light in real close, and then hold it there. Mm-hmm. Then you're holding it there over the tooth, and then When you finish doing the occlusal, you take the matrix band off, cure it from the buccal, cure it from the lingual.
Absolutely. Sounds good.
Okay.
Well, thank you so much
You're
for
welcome.
joining us today. And if you have any other questions on curing lights in general, ones we've evaluated or ones you'd like to see us evaluate, or any questions for Dr. Price, then give us an email at connect@dentaladvisor.com. I'm Dr. Anna. This is Dr. Richard Price. Thank you so much.
Thank you very much.